Yeah. I'll be talking about the multi-zone refraction analysis, the PSF or the point spread function and the modulation transfer function using the iTrace. Now, the iTrace actually captures images through two formats. One is the placebo disc, and the other one is by firing the infrared beams into the eye. So what happens is that as these individual beams are going into the eye, hitting the retina and coming back and being analyzed, so this is generating something which is called as the retinal spot diagram. So this retinal spot diagram is critical because it contains all the information that is related to the patient's refraction, aberrations, as well as the point spread function. And the cylinder and sphere obtained through calculations are based on the Zenicke's coefficients, and it also has an optometer. So it has a measurement range of plus minus 15 diopters with plus minus 10 diopters of cylinder. And it can measure through a large variation in the pupillary diameter, right from 2.5 to 8 millimeters. It has a very good accuracy of plus minus 0.1 diopters. So, to understand diffraction using the eye trace, it uses a highly sophisticated system, and we have, the ability to fog, auto fog, fix on the fixating of the patient, relaxing the accommodation of the patient, and all these they have shown in several studies that the correlation of the manifest refraction versus the eye trace refraction is very, very good, up to the point of less than 0.12 diopters. So as I was saying, we have the settings, and in the settings, we can actually have multiple zones in which we can study the refraction, which leads to the multizonal refraction analysis. So how does it help us, knowing the refraction of various zones? It helps us to solve the mystery of day to night vision complaints and to resolve patients who have post-operative visual dissatisfaction, and it tracks the changes from scotopic to photopic conditions. Just as an example, if you look at this Tracy refraction map, and if it's in red, it indicates automatically that this refraction is abnormal. Green would be normal. And so this patient, as we see, as the pupil diameter is increasing, the patient is having more myopia. So this is what is leading to the night myopia. And usually this is related to the high degree of spherical aberration in these eyes. We also have the visual simulation charts. So this is through a 5.2 millimeter pupil, and this patient is having a blurred letter, and we can show to the patient, listen, this is the cause of your complaints. At 2 millimeter pupil, it clears up, and the patient has no such symptoms. Now, we know that all 20/20 vision is not equal, and it may not be satisfactory. And point spread function is one of the important things that the iTrace tells us, which helps us to actually, both understand the patient's problem as well as explain to the patient. So the PSF is what a star or lights from distance would look like to a patient. For example, in this example, the patient is having a starburst kind of a pattern, and in this we also have a software which displays it in 3D. So if you see something like the Burj Khalifa, it's good, and that means that the light is being seen as a point in these patients. The Strehl ratio is the ratio of the peak focal intensities between the aberrated and ideal point spread functions. So ideally, it should be 1. And the point spread function is calculated for both the whole of the eye as well as for the higher order aberrations. Now, what is the importance of that? Importance is the higher order point spread functions cannot be easily corrected, and they may require a customized approach. And they can be used along with visual simulation charts to understand and explain the patient's symptoms. So this is a patient. We see the total eye PSF without spectacles and with spectacles, and we can see how the visual problems have just disappeared simply by the use of spectacles. On the other hand, this patient has a cataract. He has an internal PSF, and only a cataract surgery could actually make the distortion go away. Then coming to the modulation transfer function. So this is a typical modulation transfer function chart. Now, what does it tell us? What do we understand by that? So it is derived from the point spread function. And in very simple terms, it is the ability of the eye to transfer the contrast from the image, from the real image to the retinal, what the patient is seeing. So it's a very, very important unit of visual performance. and it's used to assess the success of IOL surgery, refractive surgery. So it's a modulation ratio, so ratio of the object image contrast to the object contrast. So if you look at this chart closely, we have on one side, on the left side, is the contrast, and on the lower side, on the x-axis, is the spatial frequency. And for simplicity's sake, we take the value of 40% contrast at 10 cycles per degree as the cutoff value to what would make a patient reasonably satisfied with his vision. And although it's a little complicated to understand, but basically, if we look at these gratings, so once these gratings are getting closer together, they will start blurring. In very practical terms, if we see, if we are somewhere at the beginning with a high contrast of 100%, it would be something like reading a billboard. On the other hand, once we move towards the right, it would be resemble the amount of effort we take to read a normal writing. And as we go further down, it would be something like reading small labels on those prescription bottles, which are very so difficult to read. This is an example of a patient, and this patient had an internal MTF which was low. The patient had a cataract, and we can see that this MTF is just touching the border of the 40% and 10. This means that this patient probably is not a good candidate for a multifocal IOL. Why? Because we know that multifocal IOLs make the contrast go down. And once we put an IOL, the graph would probably come into the red range, and patient may not be so happy with what we have done. Another example, this is a patient had a cataract and underwent cataract surgery and was pretty happy with the result. A 6'6" patient unhappy with the right eye vision. Once we did the MTF, we could see that in some way that was what was leading to the comparative difference in what the patient was perceiving. It also helps us in making a decision on refractive enhancement. This patient had undergone LASIK surgery, was not happy with his vision, and so we had to take up this patient for an enhancement. And we could see post enhancement how the MTF has improved in this patient along with the tracy level. A green tracy means that everything is okay, and we can proceed with treating this patient. So this was the visual simulation chart before treatment and after treatment. Well, thank you very much. And as sir said, we can take questions in the end or now. All right. Thank you, sir.